Well, I just gave a great introduction to that while I was on mute, so chalk that one up to me. So we have a fairly full agenda. We shouldn't run too long, but lots of items to cover today. So I will go ahead and turn that over to you, Val.
All right, thank you, Heike. Good morning, everybody. Sorry I missed you 2 weeks ago. I took a day off with my kids and we had a good time, but we're back at it today. Fusion cell update real quick. I just got off the fusion cell call. Missouri's positivity rate right now is between 4.3 and 4.6%. Our rates per 100,000 are below 9 people per 100,000 residents that are COVID positive. Our reproductive rate for the state is also below 1. And what that reproductive rate means is that for every person, if that's above 1, that means that every person who has COVID is transmitting COVID to someone. If that rate is below 1, that means that that transmission is not taking place. And so you want that reproductive rate below 1. I know we've been getting a lot of questions from folks lately about what are all the things you look at to make decisions about resuming visits, monitoring, activities in the community. And it's not just one thing, it's all of these different things. And you really need to look at them over 7 days and over 14 days because of how things get reported to the state. And while the state is monitoring that reporting progress, that's why we look at all of these different areas. So with that said, all of those numbers look good. What we are seeing in our positivity rates, though, is a slight uptick. So earlier this week, that positivity rate was between 3.9 and 4.3%. So at this point, we're not concerned, but we are monitoring that because it could be that we just got a bunch of positive results if we're waiting for some negative results to counter that because we're at that low positivity threshold for now. So we are monitoring that, and we will continue to monitor that for all of the activities and make sure you guys are aware of that as well. Our DD community case numbers for March were the lowest that they have been since the start of the pandemic. If you'll recall, last year in April, May, and June, we would see between 19 and 21 individuals per month in community services testing positive for COVID. March ended us with 21 people testing positive for COVID that are supported in the community. So those are numbers we really like to see. All that in doesn't mean we stop doing those important things like testing, wearing our masks, washing our hands, following social distancing. So please continue to do those things. On the testing side, one of the probably, and I expect this will get pushed pretty hard across the country over the next few months in the summer, is that rapid antigen testing. The product is really called Binax Now, and the Department of Health and Senior Services is going to make that antigen testing available to our community providers. There's no cost in terms of the test. There is cost in terms of time in doing the test. So on April, not like actual monetary cost, you're writing a check to somebody, but cost to your organization. So I want to make sure we do know that. But the Binax Now testing webinar, Health and Senior Services is going to lead that and introduce our community providers to that Binax Now, otherwise known as antigen testing or rapid testing. That is scheduled on April 6th, which is next Tuesday, from 12 to 1. Noon to 1, so over the lunch hour. We've sent information out via our targeted case manager tax and our PR staff to all providers. If you've not gotten that information, please go through your regional office so that they can get you that information. If that information didn't filter down to you or filter up to you and you are interested, please make that request. Again, that call is on Tuesday, April 6th during the noon hour. We will be recording that webinar so that we can make it available to folks as more information comes out so that they know how to access Antigen/Binax Now/rapid testing. How we still use rapid testing in the department, we, for our congregate care facilities, we are using rapid testing, usually try to do that twice a week. We don't necessarily do it with all staff. We always use it in the event of an outbreak, but we are trying to just make sure we know we're still continuing our testing rhythm, although we have scaled that back quite a bit. We are actually now to the point that we're not using PCR testing much at all. I don't want to say that at all because we are still doing a lot of it, but not to the level that we were doing, and we are relying more on the Buy Next Now testing. Also, we are following up any positive Buy Next Now tests with a PCR test, and that's the nasal swab test, either self-administered or up the nose, or you go somewhere to get that done. We do that predominantly because we know the Buy Next Now tracks positivity, but the Buy Next Now cannot tell us if that is a positive COVID test for what we could term as regular COVID, and if that is a positive test for one of the variants, like the UK variant that we're all hearing about. And so we strongly encourage everyone to follow up a Binax or an antigen test with a PCR test if it is positive. Also, sometimes the Binax will reveal a false positive, and so the PCR can follow up and get you additional information. If someone does test positive on a Binax or an antigen test, we do treat that as a positive until we know differently. So, and we've come across some very unique situations across the state, but please recognize we do a lot of testing. And so we can address those as those come up, and we can support you in doing that too, but not a lot, like very, very few. But no testing method is perfect. We all know that, but it's great to be able to make that available to everybody and affordable. Also, and we don't have this information yet, hopefully I will have it by end of the day today. Health has said that. If I don't, we will definitely get it out early next week. But community testing locations will be changing across the state. So please look for that information to come out too. Community testing is still a very important option that we have available to the residents here in Missouri. So that's what we've kind of got on the fusion cell and the testing update. Of course, the other thing that's really important when we're looking at all of this is vaccinations. Please remember that all Missouri adults are eligible for COVID vaccinations starting on April 9th. So not this Monday, but next Monday. Everybody over 18 is eligible for a COVID vaccination. They are working on setting up a lot of mass vaccination sites next week and even the week after that. Also, we do expect that sometime in the next month of April, our supply will probably outweigh our demand. And even when we're looking at ordering numbers for vaccines, we're starting to see that, I mean, we were continually seeing the demand was always higher than the supply. We're starting to see that level off. So please make sure you spread that message to far and wide. Also, anyone ages 16 to 18 can get the Pfizer vaccination, and there are certain places where that's available. I know like Hy-Vee is only doing Pfizer vaccinations. So if you've got a 16 to 18-year-old that you want to get vaccinated, some of them may already be eligible if they have after-school jobs or if they are high risk. But also after April 9th, all of those will be eligible too. And Pfizer is the vaccine that is approved for 16 to 18-year-olds. Another thing that we are working on at the state level is we are data matching individuals that are in our system with those that have been reported to Health and Senior Services as being vaccinated. So just so you know, for protection of information, we send them the list of our individuals. They send back to us percent. So I still can't tell you, I can't take data from Health and Senior Services and check a box in the DD in our computer system that says someone has been vaccinated or not. But what I can do is I can look at percentages by age, by type of service. So those are things that we are going to be working on so that we can possibly, and maybe even by region, so that we can start continuing to work on our vaccination efforts. So I look forward to sharing that data with you as soon as we get that available. Vaccine hesitancy is really, you know, the early, so we've been doing vaccinations now since mid-December, really in Missouri about December 21st. So December to January, January to March, a little over 3 months. All of the early comers, I mean, we haven't been able to get everybody covered, but for the most part, folks should be able to access vaccine that want vaccine. And now we're really focusing on those individuals that are hesitant about getting the vaccine. So I do want you to pay attention. There's one of the reasons that we know, at least on the state side, and we do have the benefit of working both with the prison system, the correctional system here in Missouri, with DYS, with the veterans home, so we get to talk to each other a lot. And one of the things that we did hear early on about people not wanting to get the vaccine was just why get the vaccine if we don't know much about it, including how long it's good for. So there is some new data coming out on how, because we have more data on how long the vaccine seems to be good at protecting folks. And I believe Pfizer is releasing data today that says, and it may have been yesterday, that their vaccine effectiveness is showing strong effectiveness 6 months out of vaccination. So hopefully as we get more of this data, we're able to incorporate that into our messaging and get more out there to kind of contra or go against the vaccine hesitancy messages we've got across the board. And again, what we at the state still see to be the best way to address vaccine hesitancy is just making sure we're aware and we're educating our staff on all the vaccine opportunities that are available, because it's really when someone's ready to get vaccinated, we want to make sure that they can get vaccinated. And so that's still something that the state is working on. But as we push out those information about vaccination opportunities, we appreciate if you can share those so that we can, and that falls under that category of reaching people where they're at when they're there. I know we also are, I want to do budget, and then I'm going to go back to getting back to the community and the new normal. So on the budget side, for those of you that are budget geeks like me, we have completed, for the most part, the budget through the House cycle. And so the governor actually did, I say drop an amendment because that's the lingo, but he filed an amendment and the House accepted that amendment a couple weeks ago. That amendment actually increases money for our rates for our residential providers. It's $50 million in general revenue. That equates to about a 20% rate increase for most of our residential providers, or most of the individuals in services. It's a little over, I think, 5,000 individuals in services that will be affected by that rate increase. Additionally, the House has another bill that is out there that would add another $6.2 million in general revenue to rate standardization. And that, I'm not sure where that would land, but if that $6.2 million stays in, that would get us to $56.2 million in general revenue. That's the total amount of general revenue we need to standardize our residential rates. And that's standardizing those rates to FY20 lower bound rate study, for those of you that are familiar with that talk. So very excited to see that. And we also have money in the budget to ensure that we don't have a wait list moving forward. So those are really two big budget items that have really made a lot of progress through the governor's office and the House. Next stop is the Senate, and we expect Senate hearings will probably start not next week, but the week after that. So that week of April 9th and moving on. All budget action by the legislature, I think, has to be done the first Friday after the first Monday in May, something like that. It's usually around May 10th. So we will keep you updated on that, but very, very excited news for us, for the individuals we support, for our providers, for the people that work on the front lines, our direct support professionals. Another thing I've been talking about a lot is wait list. So we are, and I do think, I'm kind of making this announcement today, but more formally on Monday, I do believe we will completely open up all the community support wait list and the residential wait list, comprehensive waiver wait list. So we were adding 26 slots a month, but we've looked at the budget and we believe the budget could support, if everybody came on board April 1st and billed everything up through June 30th, we have enough budget authority to support that. So we are excited to make that announcement that we will no longer be just doing 26 a month on residential, 90 a month on community support. We're able to assign all those waiver slots at this point. We may still need to do some additional waiver amendments to get more slots added. For those of you that have kind of followed that budget conversation along, last September, we didn't feel like we were going to get any of our money for our wait list. And so we had made we submitted a waiver to CMS to decrease our waiver wait list slots. And of course, I think the day they approved it, the next day we got all the money back in our budget for our wait list, which is good. You know what, it's good, and we're glad to send another amendment to CMS asking us to increase the number of slots we need for our wait list. So that is exciting information. I did see a question in the chat that specifically relates to the budget. I believe it's about autism project funding. So there is no really change in the autism project funding, no increases or no decreases in the budget as of now. I am kind of hearing rumblings there may be some increases on the Senate side, so we will keep you updated on that as we learn more. But right now it's status quo, which is also a good place to be, because it was even status quo whenever we were doing big cuts in the budget. So that's a good place to be right now in the budget. So some additional questions, and I know there's a question in the chat about this. So we're going to try to address, before I specifically address the question in the chat, I just want to kind of talk through some stuff. And I'm going to do this kind of quickly because it's stuff that we've been saying, but hopefully maybe there's some new words in here that help you guys do your work or make people more comfortable with moving forward. So you are aware that we issued the case management guidance at the end of last week. It looks a lot like the guidance. There were not a lot of changes from the guidance that we had issued last July. So we know that COVID is going to be with us for the foreseeable future, and we have to figure out how to live with it. Vaccinations are a very important tool, but they are not the only tool. And that's really been a big part of the CDC guidance that has come out. You've still got to do the testing, which is why we're trying to make it even easier for all of our providers. And you've still got to wear the PPE, and you've still got to social distance. So mask up, okay? We know that COVID is a risk, but the numbers that I talked to you about earlier are low. Those are low. A reproductive rate below 1 is very, very good information. What that means, and it's even what we're seeing in the data, when a county has a higher positivity rate, folks are not transmitting that to other people. We're able to really keep the COVID contained at this point, and that's really, really important. Also, hospitalization numbers across the state are going down. So that's also really, really good information. But we also know that people have got to resume their lives. And so you're weighing the COVID risk with that risk of isolation and the impacts of being isolated away from family and friends. And that's why it's so important for us to resume that monitoring activity. And that's why it's really important for both on the family side. Our families need to understand how important it is for us to resume this monitoring activity. The the providers, I fully believe our providers understand how important it is for us to resume this monitoring activity, and our staff need to understand how important it is to resume this monitoring activity. We believe that most activities at this point can be resumed fairly safely. You still have risk mitigation, but you always have risk mitigation. It's just a different type of risk mitigation for COVID. Also, we know that we want to make sure that on the provider side and even on the family side, when we're talking about doing monitoring visits, that staff providing these monitoring visits are they're not visitors. They are there as part of the service. So please make sure that's another way to kind of get this message across. If you want to, service is important, but monitoring of the service is also important. Please stay on top of your COVID policies and update as needed. And we've talked about how quickly the CDC guidance changes. It's very, very difficult to stay on top of that. But I really do like the CDC guidance around visitation and long-term care facilities. As if you're just looking for one to monitor, I highly recommend that one as one to monitor. We do want to make sure that everybody is abiding by agent. So if you're going in somewhere, you really need to abide by that agency's COVID protocol. So for example, while we do not require testing of anybody coming into our state habilitation centers, we do make it available for both families that are coming in to visit, licensure and certification, anybody else. And on the state side, we also, and I'm not saying you guys need to make testing available because it's a congregate facility, so it's a substantially different than most of what people are offering, but it is a way to help ensure. Another thing, if a facility requires masking, you need to be wearing a mask when you go in. It's not a question, it's okay, because it's necessary to do your job. Again, we've said multiple times, any decisions should not really be made solely around vaccination status. It's one piece to the puzzle, but you've got to still, even I am vaccinated. I still wear a mask everywhere I go. So you still wear the mask. I know we've been getting some contact tracing. Yes, that's also really, really important to discuss. So if you do find out as a provider going in to do monitoring, or as a provider with people coming in, or after the fact if they've been there, please be responsible and do your contact tracing. So you still really need to keep track of who's hitting and out, who is going places. Please do that contact tracing. It is very, very important, and it should be incorporated into your policies. We, of course, and you've said this and you know this, we will continue to monitor virus activity and update our state map on the COVID website. Like I said, just based off of today, we're seeing an uptick in positivity rate, still below 5% for the state, but we will be watching that to see if that's a blip because of data or if that is really representative of what's going on in our communities. And just like we did during the summer, if you are aware of something in your community and that we haven't seen yet in the data, please let us know. And I think most of you that did that through the summer found us to be relatively responsive when you told us that information. We're also getting some questions about how state offices are open, central office and regional offices. And we are definitely open 100% for appointment only. So if you need to come in and meet, please feel free to do that. We also can make our space available. If you need a larger space for a planned meeting or something else, we are able to make that space available. So you can reserve conference rooms if you need to do that. You know, we do offer some of our state offices are more than just the Department of Mental Health. They include Health and Senior Services, Social Services, Corrections, a lot of different agencies. So when we are working on strategies around some of our building locations, we're working on those with ourselves. We're working on those as a state as a total. So we don't really have any density limits in our buildings right now, but it's still something that we watch very closely. So please remember that we're not just the Department of Mental Health, or we're not just the Central Missouri Regional Office, or we're not just the St. Louis Regional Office, and I could keep going on, but we're really part of a bigger system. And so some of our decisions are decisions that have to be made on a much larger scale, looking at a lot of other agencies too. So we are also in the process of really trying to figure out how we become kind of a hybrid workforce, and what positions work for hybrid and what positions don't work for hybrid. And again, and I tell this to, you know, we've pushed that down to local leaders, but I tell this to my staff at the state level. I go, I can't even imagine how to bite that apple. So that is why it's a huge project. I guess I just want to leave it at that. I'm sorry, I was scrolling through questions at the same time I was talking, and I need to stop doing that because it doesn't do me any favors. I'm going to move it over to Leslie now, and then we'll look back at these questions. So Leslie, you're up.
Thanks, Val. Just have a quick update. The community support waiver amendment to increase Factor C unduplicated number of participants or waiver slots from 4,500 to 4,800 was approved by CMS on March 30th. And that will be effective yesterday for 1/21. That's the only update. Thanks.
Thank you, Leslie. There is a question. There's two questions kind of in the chat. I am going to go to the first one. And that was, you know, and this is a situational thing, and this is just we're going to have to spend a lot of time doing education, just even over the next year. It's not going to be over the next month. But a situational question: when a guardian refuses in-person visits from the support coordinator in a home for an individual receiving residential, but the room-based guardian does not, should we still have in-person monitoring for the individual who's guardian approved? Absolutely, you should. In-person monitoring can still be outside, but we do want you to go in and take a look at the surroundings. But yes, that definitely you should do that. And yes, you can point to us as the ones that answered that question. The other question we have are it's another good question down there. Are all assessments to resume in person? Is it still possible to conduct an assessment OCABI virtually if the family refuses in-person visits? We're going to have to put that one in because I think we're doing some stuff around just what assessments we do moving forward in July 1st. So we're going to put that one in the parking lot, and we'll send that out in our frequently answered questions because there's some changes on that front anyway. And then there was a question about the Autism Project waitlist. Will that continue? There is actually funding in the Autism Project line. So we are looking at the northwestern side, at the eastern side of the state, to see if we can get some more folks access to services in those areas. But that waitlist is separate from the waiver waitlist. That wait list is really tricky to manage because we rely on families to bill us and us to and trying to keep the number, and it's very tricky for us to manage in a year when there is no COVID and people aren't using services. So that's where we're at with that one. But we are working on that information. So great question. Actually, that's all I have today. I haven't seen any of the panelists put anything else in chat, and that does address all the questions. Thank you all for your time. Please have a blessed Easter weekend. And next week, I believe I saw 70s all week. So let's enjoy some sunshine, some fresh air. Just for fun, my son's here doing a dance for me, and I'm not going to let you see it. So I'm going to sign off right now. Thank you all for everything you do. Keep the questions coming in. We'll keep learning and doing and improving services and supports for the individuals that we help. So thank you all. Have a good weekend. Bye.